enjoy the ride with Crystal Petry Consulting. So inspiring, pushing you to your dreams.
Hello, and welcome to another episode of 60 Minutes With. I'm your host, Crystal Petry. Today we are going to be educated on all things HIV and AIDS. Is there a cure? Will there be a cure? Are people living longer with AIDS now than ever before? To answer these questions and so many more, we have Dena Hughes, who's joining our podcast. So thank you so much.
Absolutely. I'm so excited. All things AIDS. Yes, we go.
Yes. So I'm excited to have you on here because as I was preparing for this, it occurred to me that I don't, and it could just be me because I'm living in my bubble, but I don't hear a lot about AIDS and HIV anymore. I used to, but it seems like now there's not a lot of information out about it.
Yeah.
Why do you think that is?
Well, you have core reasons, and then you have all of the other splinters. I think one of the biggest reasons why you don't hear so much is because people aren't dying at the rate that people were dying 30, 35 years ago, right? So in the early 80s, 90s, there were no treatments available. And so, you had to do the best you can without having any real options. And then slowly there was the development of medication, started with something called AZT in the late 80s. And then it progressed into other antiretrovirals, and now we have an amazingly healthy and robust portfolio of medications available to people that can access it any part of the disease process, whether you're learning early and you were recently infected, or you may have been living with HIV and got tested and didn't know necessarily when you might have contracted HIV. But the medications are available now, even to the point where there are injectables that you can take every 2 months, which is really cool. So what we're seeing in terms of desperate need for resources around caring for people who were dying, that number has dropped, not gone. People still succumb to HIV, who may not have had access to treatment or care systems. But it has gone down, and the attention really becomes focused more on prevention and how do we prevent. And prevent it's a tough place because, how do you prove what didn't happen, right? It's hard to say, but no, so you have to look at the rates of HIV transmission to know, okay, what some of the things that we're doing are making the numbers go down. But it's hard then to go, we got to get the numbers down when you're getting the numbers down. So it's part of it is a marketing piece. If you look at some of the commercials that you see on TV now, they're like, you can live with HIV, right? And it really is promoting health and life and wellness. But then you're still talking about, we don't talk about sex the way we really should be talking about sex and sexuality and knowing our bodies and how they work. Or being able to talk to schools with young people that have age-appropriate health information. Those are still a lot of the challenges that we have because HIV still is a very stigmatized disease. So talking about how to prevent it means you have to actually talk about it. And those two sometimes don't always go hand in hand.
If I'm hearing correctly, it sounds like the reason that I'm not hearing about it as much, and I'm sure my audience isn't hearing about it as much, is because the numbers are down, people aren't dying at the rate that they used to, which would be considered a win. I would consider that a win, right?
That's a win. That's a huge win.
So we're not hearing about it because of a good thing.
Right. I mean, sort of, kind of.
It's like splitting hairs. But that's the reason we're not hearing about it as much.
It's just not, you're not having funerals every weekend, right? You don't have a collective community grieving loss, right? And so that was a huge component back in the day. I call it back in the day, 30 years ago, was loss. It was really centered around how do we stop losing people? How do we, make it possible for people to live? So we've got to learn how to cheerlead the good things like the new medications and the options that you have. But by the time you get to a medication, you're already positive.
Exactly.
The goal is to keep you from being positive. And so again, we're going back to where are we able to have conversations about HIV? Are we still having them around our dinner table? Probably not. Are we having them with our kids when we talk to them about sex and first boyfriends and things like that?
Are we talking to our kids
Probably
about that?
not. Are we talking to our kids about that? Are we talking about STIs as they call them now, STIs? Are we talking about, those? Are we talking about pregnancy in the same format that we talk about HIV? But if we're not talking about any of this, if we're not having a healthy conversation about any of these things, then you're not going to hear about it. That because it goes along with, oh my God, Mom, Johnny spoke to me and he's so cute. Okay, at that moment should be when a parent or a family member or someone that the young person would trust can start going, okay, so are you familiar with, have you heard of, do you know about? But a lot of us don't have the language and the knowledge to have that conversation. So it is a definite struggle. I am here from Houston, where I was heavily involved in the HIV community, but now living in Beaumont in a more rural community. If I don't talk about it, or if I'm not in a committee, dealing with it, then it may not be a part of the conversation, and sometimes you get tired too of always being the HIV bell ringer, ring. Oh, sometimes you just want to have dinner. So that definitely is part of that space.
Yes. Well, thank you for being the bell ringer on my podcast.
Absolutely.
I appreciate that. I appreciate that. So STI is, what is that acronym for?
Sexually transmitted infections. So you're talking gonorrhea, chlamydia, syphilis, herpes, HIV, Hep C, depending on, the Hep C can get categorized multiple ways. But these are all infections that you simply get by having sexual encounters with someone who has the infection and there is no protection.
Okay.
Plain and simple. And so the infections can be anywhere from your mouth to your vagina to your anus, wherever you're having sexual intercourse or sexual activity, and there is no protection and fluids are exchanged, you run the risk of transmitting an STI from one person to the other.
Okay. So give me, what is AIDS and HIV? It's two separate things, right?
Right.
But people, including myself, speak about it interchangeably as if it's the same thing.
Sure.
But it's two separate.
They're two separate things.
So explain that to us.
And and everybody kind of has their school of thought. HIV has been around now, over 30 plus years, of course. And so there are generations where dynamics have changed, kind of like going from Negro to Black to African American to there's a progression based on knowledge and information. AIDS was one of the first terms given the disease, not HIV. It was acquired immune deficiency syndrome, and then there was a name before that, gay-related infectious disease or something like that. GRID. And so the acquired immune deficiency syndrome just simply meant there was something that's causing all of these things to happen, and the person acquired it from somewhere, right? Acquired immune deficiency because it affected the immune system, right? And there were different things happening because by the time people started presenting with illness, there were multiple things popping off. It wasn't just one thing. So there's a syndrome of things happening. The person's immune system is not working. They must have gotten it from somewhere. Acquired immunodeficiency syndrome. HIV is human immunodeficiency virus, right? So as they were doing the AIDS part, acquired, where did it come from? There's this virus. There's a thing that we're finding that is causing these things to happen in humans. So human immunodeficiency virus is the virus that allows you or permits you or segues your body and your system into a syndrome, right?
Yes.
And so medically, they use the definitions differently because they equate to a measurement, how much HIV virus is in your body, right?
Oh, so you can measure it.
So you can measure it, yeah.
Okay.
It's called a viral load. And so this came up years ago. I remember when they first gave me my first viral load test, and they called and they said, Dena, your viral load is 800. And I was like, oh my God, what's going to happen, right?
Is that high? Is that low?
At the time, it was considered low,
Okay.
right? Your viral load is what we look at when we say you're undetectable. We cannot detect the virus in your blood with this particular test. Now, it doesn't mean the virus is gone, but we've been able to reduce it to the point where it's not transmittable.
Okay.
So the viral load is what we look at to determine, along with a person's CD4 cell, which is your immune system, how is it running, how is it going.
Okay.
So if your immune system is high and your viral load is low, that is the perfect equation. We want the viral load to be undetectable. That allows a person to engage in activities in their own lives that does not put them or another person at risk. Still use protection, but it allows you the freedom to really live your life a bit in a more healthy way. So that's what we look at, is that viral load, and that's what the medical community looks at. So if you're under if your viral load is above a certain number and your immune system is below a certain number, they will classify that as an AIDS diagnosis. But it's just simply to say this is a group of people that have different health outcomes than individuals who are simply living with the virus.
Okay.
That's the way, that's the way it always made sense to me. That's the way I explained it. But of course, it makes sense. And so a lot of times people will change how they refer to it. So like I call it all HIV disease, because I'm not really talking in the medical sense to people when I'm having a conversation.
Yes.
I will explain it like this if ever asked, what's the difference? This is how I would explain it.
Okay.
But typically, it's HIV disease, and that kind of encapsulates all components of it.
Okay, so that's how I will refer to it during this interview. So you were talking about the viral load numbers. So what would that number be that would be considered undetectable?
So undetectable would be under, I want to say, like what we call 50 copies. And it's a medical term. So you can go all the way up to 1 million, and you can go all the way down to as low as, it may be less than 50, and it may be less than 20. Okay. I'm not sure what the standard folks might use, like the CDC. Had to look that up. But it's very low. So like my viral load is undetectable. I go in, I have
you're under 50.
I'm under 50 copies.
Okay.
Right? And throughout everything, the test says, I can't see it. I don't see it nowhere. Okay. And then we go, okay, great, right?
Well, doesn't that mean you don't have it?
It does, no, because if I were to stop my medications or remove the barriers that are keeping the virus from replicating, it will pop off again. It will just there it goes again, right?
Okay.
So we used to compare it to, like, if you cornered a mouse, right? You can keep it cornered and it's gonna and the minute you back off, that thing is gonna go and it might even attack, right?
Yes.
So if you take your foot off the brake, then what happens? That virus is going to just begin its dance again. And so you don't want to, it's very important to remain on your medication, because if it flares again, you can have a flare at 20 when you're first diagnosed. Like for me, I was diagnosed at 21. Body, I had a, kid body and, very healthy athlete. Your system can handle an impact. Girl, I'm 55. I cannot afford an impact. I cannot afford an internal impact. I cannot. So, stay on those meds. Yep.
So is this one of the things, like when you go to the doctor, they give you like amoxicillin or whatever, and they say take all of it?
Yes.
Because most people, I feel better now, so I stopped taking the medicine, but then it comes back worse than it did before.
Absolutely.
So is that the same situation?
It definitely has the potential to be that. You do not want to stop and start, because then, I mean, these are heavy duty drugs, and so you don't want to put your body at risk of developing resistance or not being compliant to what you needed to do because you didn't complete the regimen appropriately. I mean, it's one of the reasons why I chose the injectable, because I'm a horrible pill taker. Horrible pill taker. So when they said
our strengths and weaknesses.
right, when they said they got a shot, what? A shot? Count me in. I mean, but I started this game when there was nothing, or AZT was the only option, and so a shot is like, girl, every 2 months, absolutely.
And that's it. That's all
it.
you do?
Yes.
Wow.
Yeah, I know.
That is good.
It is. It's great.
That is really good.
And unfortunately, the challenges that we face is we want these medications to be available to everyone, and we want to make sure that it is affordable, because it's very expensive medication. HIV is not a cheap disease. It's not a cheap disease. And so we want to be able to make sure that people have the best, tool available for them, so that they can live that healthy, life. But in the prevention, and it's the same way. We're developing new prevention technologies like PrEP for people who are HIV negative, as a way for them to continue to remain negative, no matter who they encounter.
Why would you want to take that if you're negative? Negative, in my mind, means you don't have the disease, right?
Meaning that you do not have the disease.
Right.
But if you engage in a relationship with someone and you don't know their status, right? Condom is an option, absolutely. But now we do have the ability for people who want that option to eliminate the risk of HIV, there is the PrEP protocol that allows that. So if you're taking a vitamin every day for, vitamin C for this and D for that and zinc for that, then why wouldn't you take a pill to prevent HIV? And it's not a testimony to your lifestyle or your choices or whatever. It could be, I met this really beautiful lady named Dena, and she is so sweet, and I like her, and I want to date her, though I'm married. I want to date her. I'm positive. And so how do I ensure my partner remains negative?
Okay.
I know I can do, right? But you can get on PrEP, and we can have a wonderful time, right?
Yes.
So there are, we got to be careful not to put our own reasons why onto another person for the utilization of the tool. It's one of the reasons PrEP really struggles, because people are like, why would you take it if you're not? Well, you don't want to get it, do you?
Exactly.
So that's there it is right there.
Okay. So my follow-up questions: if your viral load is low, under 50, you're taking PrEP, can you not that we're
PrEP is for the person who's negative, viral load under 50 is for the person who's positive.
Okay.
Right? Okay.
Yes.
So you have an undetectable and a protected.
Yes.
Mm-hmm.
So if we have these things in place, can you, not that we're promoting unprotected sex, but could you have unprotected sex and not, like, the person that is detected and their viral load is under 50, could they have sex without using a condom and not transmit the disease?
If I would, my answer will be a yes, with these following pieces.
Okay.
One, that you're undetectable, right? You need to know that your system is working at its fullest capacity, and you're doing that. The person who's on PrEP has to be committed to PrEP. It has to be a commitment. You miss and you continue to engage, you run the risk of leaving the door open for for a transmission to occur. And so with those two intelligently intentional situations coming together, then sure. Like I'm 55 now, so I think about it like from a married couple standpoint, right? A serodiscordant couple, which means one person's positive, one person's negative. That's the opportune, and they're monogamous, right? That's the opportune experience for them to have if you didn't want to have the inclusion of a condom, right?
Okay.
That would be a win. But then you also have to make sure that you're not trying to get pregnant. You have to make sure that, we're not dealing with other STIs that can be transmitted.
Okay.
So PrEP is all, and this format is good, but it's not the barrier for everything. It's just the barrier for HIV.
Okay.
Yeah. So yes,
I am
but
so understanding this now. So understanding this. Okay, so when you were, I guess, positive, you were 21. That was whenever. I'm not going to do math.
Girl.
I'm not going to do the math.
Woo!
What was your emotional state at that time?
It's funny because it was the analogy I use is the movie 300. Do you ever see it?
Oh yes,
the 300 Greek.
Yes.
Yeah. Mm-hmm.
Yes.
And you know the scene when the messenger comes to deliver a message, we're going to take you over, and he has a conversation, and then he kicks the man, and he falls back into this big hole.
Yes.
Remember that?
Yes.
That is what it felt like.
Really?
That's what it feels like. Because when I saw that movie, I went, that's how you describe that,
analogy.
So hearing HIV, it just was like, what?
Yes. And I feel like at that time it was still considered a death sentence.
Absolutely,
right?
absolutely. So the doctor, as sweet as she was, her response was, well, people with HIV can live like 5-10 years, and I'm thinking, girl, I'm 21. What are you saying?
Yes.
Jesus. Okay. So yeah, so that was super intense for a while. But I was so very fortunate that I had a wonderful family. I had good friends. I was, oddly enough, I was attending the university. And so, my thought was, okay, this is not something that I'm going to be rolling with like on the quiet. I can't. It's impossible for me to live like that. Like,
So you didn't keep it a secret?
I did
because
not.
Most people then and now,
they
keep
absolutely.
it a secret.
I was not about to walk around with that all my life. Absolutely not. 5 years, 7 years, 10 years, was not going to do it. And so I told, I started off with a small circle, and I told them, but I never prohibited anybody from saying anything or telling. I told people as it was natural for a conversation. I told people, I've made it a part of my conversations with people. It took a while, and I finally had an opportunity to get involved in the HIV community where, okay, now I can be in a space where we can talk about this all the time.
Yes.
And it doesn't matter. We can be at lunch or dinner, and we can have this conversation because now there's a community. And that gave me kind of the confidence and the courage to do it in my ordinary life. And then I ended up getting work in the community. And so at that point, it was like, Dena's the HIV girl. Okay, that's fine.
Yes, yes. And now you are married. When you and your husband were dating, how did that conversation start?
Well, it started really easy because he's also positive, so it made it very simple for us to navigate that space. He is not he's not anti being engaged in the community. He's very much an advocate, but like a lot of people, life is life, and you live it, and if and if you don't, that doesn't affect him. But we met, and part of it was looking for that level of companionship that's deeper than necessarily a sexual relationship, right?
Right.
Because we know we can have sex. That's great, good. But then what else, is there? And, dating and being HIV positive is hard as hell. I mean, if there's no other... Girl, oh my God.
I mean, dating is hard as hell by itself.
You want to add that? Oh, come on. I mean, I went through I was married, so I have a daughter. She's 28 now. Beautiful young spirit that lives in Houston. And, her dad and I were married, and we divorced, and so I was a single mom. And so then, I would tell people, look, I got a 2-year-old kid and a 3-year-old virus. What we doing?
Wow.
What we doing?
I love it.
What we doing? Because,
yes.
And so it was hard. One night stands become, don't do that. I mean, there's so many things about how you, especially as women, being honest about our life and our space and how we move in it, and being realistic about it, HIV will make you rethink all of those things. Like, does he seem like the kind of guy that's going to be understanding? Does he? And so yourself would say, he don't, do we? No, let me go and move around,
Yes.
So it makes you a bit more mindful. And so when looking to settle down, I was more intentional in wanting to find a relationship with someone who had similar understandings as I did, and we were walking kind of a similar path, and we could walk it together. So, yeah.
So at one point in time, and of course this is not true for you, but I remember at one point in time, AIDS, HIV was considered a homosexual male disease. Is that still the case? First question. And was that ever the case, or were they just being blamed for the disease?
Ooh. I've never heard a question put so well. The virus was first noticed in a large quantity in the gay community, right? But that did not negate its presence in other places, right? So we know that HIV is transmitted through sex, but it's also transmitted through needle sharing, right? And so you may have one population, and I personally think, having been a part of it to a degree in real time, it was gay men are blah, blah, blah.
Yes.
But they didn't say anything about the addicts over here.
Exactly.
Where it was also on fire. But the addicts were black or brown. And so
no one cared.
There. But you guys, we're gonna really massacre you, right? And so when I first got involved in the community, it was gay white men that I ran into first, right? Couple of chicks along the way, but definitely the gay community. And that's where, I mean, if I got any kind of backbone, it's from my mama and them, right?
Really?
Because they were, by the time I ran into the community, they were fed up with being accused of shit. I mean, they were over it, and really, nationally began to respond and fight back, and then demand, services and support and research for medications. I mean, they did all of these amazing, feats of strength to get us where we are today, where we could take an injectable, right? These were the people that really sparked the movement and aligned all the components. And, the rest of us came along, right? As the numbers began to grow in the black and brown community, among women, we fed into a system that had already been created and designed. So were they blamed and targeted? Yep, absolutely.
Yes.
When they should have been, the COVID response should have been the response 35 years ago.
Yes.
Do you know what I mean?
Yes. Yes. So we really have gay white men to thank for the progress
Absolutely.
of where we are right now.
Absolutely. And the transgender community, and the drag queen community. I mean, absolutely. I mean, the path that they laid. I mean, these were people who, there was no food pantries. There were no medical facilities people could go to. They were turned away from families. They were people who didn't even know their family members might have been gay, never mind sick. And so this community had to be the medical, the legal, the support service, the transportation. They had to do all of that for people who everyone went, meh, and so by the time they got irritated and wanted to, they really started to do something about it, that's when, I entered, when they were going, we're not doing this. And they taught us, that no, this is how this works. This is a community. You've got to go and tell it in your own community. You got to go talk to women. You got to go talk to young people. We got to spread this information so it doesn't happen to somebody else's community. You know what I mean? So they weren't only just taking care of themselves. They, expanded it and made sure that everybody had access to the information and the research and the knowledge and the medications, most importantly. So we owe, I mean, I hope history tells the story right, because there's no way that you can tell this story of how we've come so far without starting starting there, and even for a lot of communities going back to Africa. Because one of the big stories back in the day was Black people get it because they come from Africa and they eat monkeys or they have sex with monkeys. It's like, oh my God.
Oh, wow.
So disinformation is real. It's always been around, right? But you have people who've traveled and done work in Africa and all across the country, the world, to really make an impact on the disease where it is. Because you'd be surprised how it actually can spread a disease, right? So it's a global phenomenon, but nationally, you do a disservice by not acknowledging the reality of their role in it.
In this day and time, is there a certain population of people that are affected by the HIV disease now?
From a transmission standpoint, where are we seeing higher transmission rates?
Right.
Younger people, unfortunately, the men who have sex with men, and these are categories that we check off boxes, right? Because you can be a gay man or you can be a man who has sex with another man. They are not necessarily the same.
What's the difference?
They're not the same thing. It's a person's POV. Because if you say, I'm going to do a program targeting gay men, the man who has sex with a man but doesn't want anyone to know he's gay is not coming to this over here, right? Okay. So we have to make sure we use language that is kind of inclusive. And I'm old, so I'm missing a lot of terms. I still struggle on he, she, them, they. I struggle. Mm-hmm. But I do know that when you're talking about how a person performs and how they see themselves, you can't always just put a label on it and call it this thing, right?
Yes.
And so when you look at the rate of infection with young men who have sex with men who are particularly Black and brown, the numbers tend to be higher. The numbers in African American women compared to white or Hispanic women tend to be higher. When you look at people living with HIV, or you look at the positive community, we ask different questions. We ask questions around how many people are still living, and where are they going? I am now 35 years in. I am a Gen Xer, but I'm an older Gen Xer. So what are the needs that affect me versus what are needs that may be coming for a younger population that is coming, into the HIV community as a newly diagnosed person. So we look at different factors to determine where a particular resource needs to be allocated. Not everything goes to everyone. Okay. So you look at what is who's being most impacted, both in the prevention side and the treatment side. Treatment side, you could say people in rural communities may have a harder time accessing medication and care than people in urban areas. So I think it depends on what you're looking at. That will tell you what population is impacted the most. But I think overall, we all could use more of both, right?
Yes, absolutely. Yeah. So, of course, my follow-up question is going to be, as a Black woman, why is it that the numbers are so high in the Black female community?
They're funny. They're higher than white or brown, but yet they're still kind of taking a slight dip down from norm, right? Okay. I think we're still not. I think Black women and women of color are doing a better job of having real conversations about our sexual health, right? About what we want, what we expect. We're more cognizant of how to care for ourselves. Meaning, as you're older, you're more likely to use condoms. Take a test. Do those things that ensure you have a great tempo going into the game. Yeah. But then what about the younger kiddos, right? The 13 to 19, where you have a parent or school barrier to what kind of knowledge and information we can ensure that they receive around how to do these things when it is appropriate for you to do them, right? Yes. I used to always tell my kid growing up, you're not eligible for something It doesn't mean you can never do it. It just means right now, until you're
That's
18,
a great term.
you're not eligible, you know. And she
That's
would
a
just
great
sit back
term.
like, bet. And at 18, she kicked off and did everything she was eligible to do.
Yeah.
It's great, it's you. But, you know, it's about making sure you establish that conversation with the community. So for Black women, are we talking about HIV and STIs? Are we ensuring that our kiddos and our family members and our young girls and boys and our families understand? Are we promoting abstinence? Are we making sure condoms are available? Either way, right? But what are we doing to help navigate that? I think domestic violence and abuse plays a huge role in a lot of our relationships in terms of transmission, where a woman feels like she can't get out, she doesn't have any control. You're subject to other vulnerabilities, you know, because you have less choices to make in that kind of a situation. But I think access to information and conversation is probably one of our biggest barriers today. And I think it still centers around stigma. Because I can see the most vibrant young person and they're telling us how they're gonna do it and how, and they're popping and they're moving and it's beautiful. But I don't hear the conversation around, you know, my sexuality and what I do to protect myself and promoting that as a component of a healthy relationship. I used to tell young people all the time, y'all want to go on a date and you're wanting to decide if you want to have a sexual relationship, the best date to have before you do that is at a clinic. Let's all go together. Let's all go together. Let's give each other the gift of health.
Oh,
right?
my goodness.
And you know, so that's what I would tell my kids. If you want to get down, show up at my clinic for a test, and we'll test everybody, and we wish you all the best with what you're about to encounter. But at least you know you're walking into what you've already decided you were going to do anyway.
Yes.
You're walking into it with a healthy mindset.
Right.
You know?
And you're able to make an educated decision.
How scary is that?
If you're going to continue on that path to sex.
And that's the thing when we go back to talking about prevention. How many young people, because we can never do a survey on it, right? How many young people decided not to have sex that day? Dang, I don't get that number. I can't get that number. That went, how many kids in an auditorium that you talk to looks over at Johnny and goes, no, we're good.
I changed my mind.
We're good. You know, we have some things to talk about. But we don't know what we prevent.
And that's the hard part.
That's crazy, isn't
That's
it?
the hard part.
Somebody has to come and tell you, I didn't have sex.
I did. Because of your conversation.
Because of your conversation.
I didn't have sex.
Right.
Yes.
You don't get that. So
Oh,
you
my
don't
goodness.
know
Yeah.
how impactful being open with, you know, again, for me, it was being open with who I am. I wanted young Black girls to see me and go, that's how you, okay. Note to self, right?
Yes.
Because I thought it's important that you share the story and that you allow people to ask questions that they don't have anywhere else to go and ask. If you don't know a positive person, well, how are you going to get the information if you don't have anyone that you can ask? And so as I've gotten older, I used to be, the promoter of all things HIV. Saw me coming there like, oh my God, she's going to talk about HIV. But, in this space now, I'm older. There are younger people with way more digital tech savvy ways of doing it. But I'll never turn down the opportunity to, be an educated voice. I got over stigma and how you feel about me a long time ago. So I if I can, be a part of that conversation like this one, I always welcome that opportunity. It's a great subject.
It is. It really is.
It's fascinating what they've been able to do.
Is the HIV disease still on the rise? Like, is it still increasing just in all populations?
It varies, and again, it depends on how you're looking at, what population you're looking at.
Okay.
But I will say, now that we've gone through 3 years of isolation and COVID and everything, HIV continued to, funny, it still was there, still showed up. And now that the world is open again, we're moving around again, we're re-engaging. there is an anticipation to see increases in a lot of communicable diseases across the board because we're just outside, right?
Right.
We've seen an increase in syphilis. There's been syphilis task forces that have reignited to address the high increase in syphilis. And if you see syphilis, you can always guarantee that there's going to be some HIV or comorbidity around. It's not ever just one, right? They can come in multiples. And so we see, if you see an increase in one, you can anticipate seeing an increase in others. And again, COVID is going to be the post-COVID is really going to be telling us over the next couple of years what happened from 21 to 23, right? When everybody came back outside again. When that data starts coming in, then we'll, we begin to muster responses to that, because if it's going up, by the time you get it didn't gone up some more.
Yes.
So your response really has to meet the data. And right now, we're just now getting 22 data out to show us what 22 look like. So as we continue to see that data post-COVID, we'll be able to respond. But overall, STIs and communicable diseases are, definitely on the rise just because we're outside.
Yes.
No one's doing anything different but coming outside.
We're coming outside. Yeah, outside is open.
Outside is open.
Outside is open.
And we're back.
Yes. Yeah.
There's no more Zoom sex. All that sex taping we're done. We're back in face to face.
So true.
With my married ass sitting at home. I'm telling you. So yeah, I mean, and again, without the knowledge and the education, schools being down and in enrichment centers closed and all of that, where you would normally get a lot of beneficial information as how to navigate, that was also closed. And so now you have a population of young people that went 2 to 2.5 years. So imagine a 7th grader who went into COVID and they came out a 9th grader going to high school. Right? Whew. What that baby know? What that baby know?
Nothing.
So those are...
And especially if you don't have the parents that are teaching it.
Sure.
That has that confidence.
Yeah. And who was thinking about HIV during COVID?
No one.
Do you know what I mean? Like,
no one.
COVID. That was all we were dealing with. So there's a lot of things that for us as a community is on the rise. Diabetes, uncontrolled hypertension. There's a lot of things that COVID really took a hammer to that might have been more manageable before it. So
you are the CEO of TAN here in Beaumont, Texas, or is it Southeast Texas?
Well, we have an office in Beaumont, but we also have an office in Orange, and we have a mobile unit that serves 5 counties. So I'm gonna go with Southeast Texas.
Okay, so you are the CEO of TAN, which was Triangle AIDS Network, but now is Triangle Area Network.
Right.
So tell me a little bit about what the facility, what you do.
Sure. So Triangle Area Network is a federally qualified health center. So we receive funding from the federal government to offset medical care expenses for individuals who may be uninsured or underinsured. But we are a full medical service provider. So if you have insurance and you love our providers and you love our care, come through. We're happy to serve you. So I love the fact that we are kind of a hybrid, because we can bill your insurance, but we also have grant funding to support, again, individuals who may have limited options in accessing health care. We do charge, right? So free medical care is not a thing. So the nominal fee is something that families can typically afford. So it might be $25 for a mom, 2 kids, right? That may work. So we base what we charge off of a person's income and their family size. So for a single mom, 2 kids, $25 for a doctor's visit plus labs is a wonderful thing, right? So I love that. Triangle AIDS Network was an AIDS service organization that was established in 1987 by a group of gay white men. There they are again.
Really?
Absolutely. We just had a World AIDS Day event, and we recognized Mr. Jeff McManus, who was one of the founding members of the organization. But they, they saw what was happening to their friends and family, and they began doing fundraisers and events to build an organization that could provide that same support we were talking about earlier. And so that's literally how TAN developed here in Southeast Texas. It was the gay community, and they pulled their resources together and they helped construct, Triangle AIDS Network to be that provider for the resources for the community. In 2016, a lot of organizations, especially AIDS service organizations, faced a decision: grow or go, right? It was kind of one of those choices, because the HIV system had changed to where it was more of a medical management, right? Let's get you on meds, let's get you stable, right?
But what about the emotional?
Right? Or the other social service aspects,
Yes.
transportation, access to, pharmaceutical support, all of that. So they kind of divided. So TAN took the route of transitioning to an FQHC model, which was to grow, so that we could continue to provide the exact same care we've always provided. But what we liked about it was we thought, well, if we can do all of this for people with HIV, can't we do it for people with diabetes? What about the ones for hypertension? You think they need transportation too? And so the growth of Triangle Area Network is just built on the framework of Triangle AIDS Network. We really aren't doing anything different except offering the same level of service to anyone that has a, health need. And
that was so smart.
it's been one of the hardest things about it was, we loved when the group changed the name to Triangle Area. They wanted to maintain TAN. They wanted it to be what people knew. But this was a community that was okay talking about and dealing with HIV, right? They were good with it. But the expansion, Triangle Area Network, it's still a challenge for the community to go, so y'all don't just do HIV? No, ma'am, we don't. We do, if you don't feel good, we can see you, to help the community understand what a community health center is, what it's designed to do. One of the things I love most about it is we have to have 51% of our board of directors have to be patients of the health center.
Really?
So, yes, isn't that cool?
I've never heard that before.
I know. That's like saying your shareholders should be, people that put the money in the bank, right?
Yes.
So I love that, because then what we get, the feedback we get, is the community saying, how come we don't have when can we get, don't you think we should try? This is where the community brings what they believe their community health center should be into fruition, right? So I absolutely love that, because I get a chance to hear from people who use our services. And some days they're not answering the phone, Dena, right? Some days it's that, but other days it's, thank you so much. You were able to take care of my friend, family, loved one, and, we're able to expand, that quality care that we believe in. So that's TAN. We have an office in Beaumont and in Orange, and like I said, we have a mobile unit, so we like to go out into more rural areas where access to medication or lab services it's harder to access.
Right.
And so we go out into the community, and we started doing that right after Hurricane Harvey, when everybody was underwater, everybody was displaced or struggling, and we recognized that going out into rural areas, going, you need anything? They're like, I don't have any more medication. Okay, hold on, we got you.
Yes.
And so it was my introduction to the rural community. Hurricane Harvey, that was, hello, this is what's going on.
Yes.
So
TAN covers Southeast Texas, and you treat and help medically people with AIDS and people
if you have
the flu, or you're sick, or whatever,
if you have
they can come here as well.
Because we loved HIV related spaces back in the day, because stigma was so high, discrimination.
Yes.
I mean, all of that was just so, it was so nasty and ugly, that having a space that was made just for us was awesome, right? Now, it's important for people to recognize that HIV does not, it's not specific to any one person or a group. It is a disease that has to be managed medically. like lupus, like diabetes, like hypertension, like Hep C, whatever your health condition is, you know, get treated for your health condition. And so we try to, and I've heard this term used in the folks doing big things now, and it's called being status neutral. I don't care what your status is. What can I do for you, right? Back in the HIV days, it was you have HIV, but what can I do for you? Because no one else is going to do it.
Right.
That's why you're here. But now it's how do you feel? You know, is it behavioral health related? Are you going through a crisis? Is it, you know, are you out of your bipolar meds? What's going on? You know, and how can your community health center support you with what that is? Now, when you come in the door, you will get dedicated care around diabetes. We're not going to flood you with HIV information if you're here with diabetes, right? But we do routine HIV screening, and we do routine hepatitis screening on anyone. You can opt out, but at least we're able to check. But we check a lot of different things with people when they come in, just to give them a full plate of here are your diagnostics, and here's what you're reading like. Now, what are some of the issues you may have concerns about? So we're not going to run over people with, you're not going to come in saying, I just really want to, you know, do a mammogram, or I want to get a pap smear, and here comes HIV. No, everyone has their own lane, and we treat people, you know, according to what their needs are.
Can you get mammograms and pap smears here?
You can get a pap smear here, and we will refer you out for a mammogram. Absolutely.
Wow.
Absolutely.
I had no idea.
We have some amazing collaborations with community partners, because I mean, community health centers can't do it all, right?
Right.
And until we grow and get big and strong, you do what you can. So we have wonderful partners. We partner with Gift of Life. We partner with the Rose. We partner with health departments. So if someone has a resource that I know my patient needs, then we're going to work to get that person there. We're going to help figure out how to make that happen. We'll transport you if we have to. We'll try to assist with, medication assistance if you need it. We have a care management team. So imagine how many times you get a diagnosis of something and you're given some base instructions, but you don't know, like, endocrinologist, who, what, where is it? Well, how do I find it?
How do you even say that?
How do you even say it? Right. So we have care managers. So if a person needs that guidance and that help, whether it's literacy, whether it's English as a second language, whether it's, a mental health, barrier, whatever it might be, we have care managers that will sit down and go, okay, here's the paperwork. Let's do it. Let's get it submitted. Let's get you going. Because the objective is, if this paperwork is holding up your medication, we need to get this paperwork going, right? And so we have an array of services that you're not going to find at a private doctor. People, it's healthcare lingo that you just get used to. I got to have a private doctor. Do you? Really? I mean, okay, great. But I have a dual certified, diabetic, specialist. I have a psychiatrist. I have a diabetic and hypertensive expert. I mean, so like, get what you need, right?
Yeah.
But don't skip over community health because you think it's for people who have this or people who can't afford it or people who can't. If you need that provider, you may want to give us a call.
Yes.
So
it's, to me, what I'm hearing is TAN, Triangle Area Network. You service the whole person.
Absolutely.
Not just medically, but the entire person, which is so difficult to find.
Absolutely. It is. But I go back to the structure that I learned under. And so in the HIV space, if I went to, an AIDS service organization, they're asking me the same questions. Now, do you have your medical? Okay. So now where are you getting food? You got food? Okay. So now transportation, how do you get around? Okay. Do you need, and that's what we did. That's what the gay men raised money for, to make sure you had what you need. So if you're diabetic, do we need a remote monitor? Do we need a glucometer? Whatever they're called. I call everything a meter. But what is the tool that you need so that we can manage your diabetes properly? What are the tools that you need to manage hypertension properly? So it's taking the exact same process you're just changing the disease. That's all you're doing. It's just change the disease. And do you still need transportation? Do you still need medication assistance? Do you still need counseling? Do you still need, what else is going to assist you? We created a program several years ago called 1 Year to a Healthier You. And one of the things that we recognized about HIV was there's no over. You're never done, because even at 55, burnout is very real, so you hit different milestones. So same with diabetes and hypertension. You can get it under control, but you got to always watch it. You're going to be there with it until you get to a place where, it requires lower maintenance, right? But there's always some level of maintenance involved. And so 1 Year to a Healthier You was designed to help a person navigate this new diagnosis, this new chronic experience that's always going to be there, right? And learn how to incorporate it into your life. Because I don't have the same life you got.
Right.
If you're a mom and you have a diabetic, condition, but you have 3 high school boys at home that love to eat the potatoes and to put and you got to cook that, what are you eating? That's going to benefit you. So how can we help you fit this into your life? That in a way that it allows you to manage it and be on top of it rather than struggle with it. And so so we just try to take things that make sense and from a system that worked really, really well and apply it to all the other things that people are just normally afflicted by,
Where is TAN located, Triangle Area Network? Where is it located? I'm assuming like the main hub is in Beaumont, Texas. So where's that located? And how can people, like if they want to call and schedule an appointment and come in for diabetes or come in for AIDS testing or, plethora of the other diseases, how can they do that?
Sure. So we are located at 1495 North 7th Street in Beaumont. And then we are located at 3727 North 16th Street in Orange. And we have a website, www.tanhealthcare.org. We're an organization. And they can pre-register online, or they can give us a call at our main number, 832-8338, 409-832-8338. And begin the process. There is, like a normal doctor, you got to fill out your paperwork, and if you're uninsured, we do have to ask a few additional questions, just because we are getting government funding. So don't be mad that we have to ask a few more.
Yes.
But that allows us to be able to track and report, how we're using our funding properly. But we welcome. We have same day appointments. You can make an appointment.
That's unheard of.
We can try to do same day. But what I like though too is if you have a provider that you like, then when you come and you have your appointments, you get your same provider. A lot of places you go, sometimes you may see someone else. If they're not here today, I'm here today, I'm your person. But here we believe that our providers should have a relationship with their patients. And if you don't particularly vibe well with one, it's okay for you to, make an adjustment to someone who might fit your needs better. And we're okay with that too. But we have multiple providers that are available to assist patients. And our chief medical officer, his name is Shannon Schrader from Houston. He's absolutely amazing. He's been with us over 10, 15 years, and he is the trainer of our nurse practitioners, or the supporter to our nurse practitioners that really run the show around here. But yeah, it's a great group. We're probably 80% female, so very, very heavy into
Feelings.
Girl power and all that good stuff. But yeah, it's a wonderful place. I'm grateful that the founders of Triangle AIDS Network had the foresight to make the transition to grow instead of go away.
Yes.
Because now we're able to continue the same, level of service that the HIV community received. Well, by the way, for the greater Southeast Texas area. So we're very excited.
Excellent.
Yeah.
So, as the CEO, and I don't know if this falls under your intelligence or not, to me it seems like there's not a lot of like TAN-centric HIV disease-centric events that go on in this community.
Yeah.
Why is that?
Yeah, it's kind of hard, I think, and it's always been a struggle because, do you say to your mom or, your loved one, hey, listen, I'm going to this HIV event. Do you want to go? Maybe not, right? And so how do you do that? I like focusing conversations around things that HIV is a part of: sexual health, substance use, mental health, youth. How do we ensure that it's a conversation and that we're reaching? So we participate in health fairs, a lot of health fairs, and we have little brown paper bags that are nicely folded with the tan logo on it. And some people pass by and they grab a couple and they keep going. We're like, right on, have a nice day. Others come up and they go, what's that? Would you like to open it and see, right? So it's condoms.
Okay.
So discretion is important. We're not trying to be offensive. We're not trying to be, we're not trying to upset the grain, although sometimes you have to. But we try to be a part of the community in a more normalized way. But we do testing events. We do collaborate with partners to go to particular locations and do testing on clients that may be at a halfway house or a particular facility. We do testing in the Jefferson County Jail. And so we're around, but again, we're just
low key.
You're trying to blend. We're trying to blend. But we did have, for World AIDS Day, we typically have different events hosted for some of the other key HIV-related national days. National Black HIV Testing Day is in February. June, there is HIV Testing Day, National HIV Testing Day. October is Latino testing, So all of us have days or milestones that we focus on, and we may do events around those particular days because it's a national, national attention and national focus. So we partner along with some of those days to do events. But we could do more. I think we definitely should be doing a little bit more.
Is the HIV disease, people that have that disease, are they still discriminated against?
Absolutely. Oh, absolutely. I mean, and because it's if you don't know, then how do you know how you're supposed to react or act towards somebody or something? So when we took the pedal off the gas in terms of talking about HIV, the more we talked about it, the more we normalized it, the more we were able to get people to verbalize it in a more, public and natural setting. When that happened, you can assume that discrimination goes down, at least in some places, right?
Yes.
But then when you stop talking about it altogether, and now you have people growing up and they're not knowledgeable or they don't know how it's transmitted. Now we're back to, can you eat off my plate? And you're going, oh, how long ago did you get education? So it definitely, and people still live in spaces where their sexual choices may be not aligned maybe with their community or their family, and so a diagnosis will bring guilt or shame or blame in those kind of spaces. And so definitely think stigma is still very real. Discrimination is still very real, particularly in maybe housing related issues. We've always had discrimination issues with housing. Finding a medical provider that understands your situation and is willing to, see you and treat you as a patient. That's a very big challenge. So
I wouldn't have thought that.
Yeah. Not every medical doctor, I mean, you think it's my doctor. My doctor knows everything. No, they don't. No, they don't. If you don't make those efforts to learn, and not, we get a lot of referrals from doctors who may do the test. They'll offer, their patient may say, I'm not sure, I think maybe, well, let's test you. And if you're tested, the doctor might say, well, I'm going to refer you to TAN for your care because I just don't know it.
Okay.
And some doctors are happy to say, I just don't know, let me connect you with a better resource. Some doctors will say, I don't know, I don't even care. So you may want to go over there. Just depends on, where people are in their humanity, I guess,
Yes. Yeah. Now, HIV disease is transmitted through sexual contact and through needles.
Correct. And breastfeeding.
And breastfeeding?
Yes. Yeah.
How is
If
that?
a mother is positive and she's not on medication and she has an active viral load, then the virus is found in fluid. Breast milk is a fluid. HIV has to be, its best course of transmission is in a vacuumed environment. A child sucking on a nipple is a vacuumed environment for an infectious fluid to travel.
When did that become known?
Always.
Really?
Always.
Why am I just not hearing about this?
Vaginal fluid,
I know about that.
semen,
I know about that.
breast milk, blood. There you
Did
go.
not know about breast milk. I know about all the other three though.
Mm-hmm. Yeah. But a mother who is, on her antiretrovirals and is undetectable can have a beautiful
And you can
relationship.
breastfeed.
Yeah, go ahead. Because you're not transmitting virus at that point. There's no virus to transmit, and it allows, that parent to have that relationship, with their child. But yeah, a lot of women find, back in the day, found out they were positive through a pregnancy test. Do you know what I mean?
Yes.
Like, so, not everybody, doesn't just always happen. It's not always just one thing. It's usually tied to, I came in for something else,
Yes.
And so then, navigating that relationship with a positive woman who's pregnant and then post-pregnancy with, feeding, that becomes, a risk for a baby. And it's not so much anymore because, again, with technology and the medical space and the language around what do you say to a person who is either planning on getting pregnant, right? Let's make sure that you guys are all good. So you go into this with a happy, healthy, approach. Yes. Or if you come in and you discover an issue along with the pregnancy, we now know how to navigate. We know what kind of medication the pregnant mom needs to be on to be able to reduce the virus, because you also want to have a healthy delivery. You don't want to have transmission through the birthing process either, which is where fluids go all over the place. So they've been able to reduce perinatal infections and infections in babies down to virtually non-existent because, but if you have a mom, but if you have a mom who doesn't get prenatal care, because I don't want anyone to know I'm pregnant, I don't want to say anything, I'm only 15, right? So it's those kind of situations that still exist all the time, especially, we're in Texas now where you can't even say the A word, right?
You cannot.
So how are we supposed to have these conversations with young people to know that, baby, your tummy's getting a little big, but the kid doesn't want to say anything. So now you have a kid who's not in no prenatal care and shows up. These things happen all the time. And so you just want to make sure you're putting information where it needs to be so that people can make the best decisions for their own lives,
The medicine that the mothers are taking, the breastfeeding mothers, that medicine does not affect the breastfeeding child?
Only because I don't have science books in front of me with research. I can't say nothing has a consequential impact in another direction, right? But I would love to find that out. I'll find out what kind of impact it has. But I think if I had a choice of a mom taking medication and choosing to breastfeed, I'm going to go with take the medication. Or I'll go with, for me, when I was pregnant with my daughter, I was on AZT. But I chose not to breastfeed because you just don't know, and so I used a bottle with her. But now, again, education, talking to your doctor to make sure you understand the risks of whether or not you want to choose one route or another. That's that conversation that, probably needs to happen. But I would say if there were an increase in women breastfeeding who were undetectable and their child became positive, we would know about it really, really fast.
Right.
Because we've been able to eliminate or reduce down to virtually, singular digits the number of transmissions that happen that way.
So my initial question was going to be, before you just completely educated me on this. Okay, so just to kind of review, you can get the HIV disease through sex, needles, breast milk with breastfeeding babies, and what was the other one? Blood. Okay,
Needle sharing. So
sharing.
you have the fluids and you have the modes of transmission. So the fluid is the blood, the vaginal fluid, the semen, and the breast milk. The mode is unprotected sex, needle sharing, breastfeeding, right?
Okay.
Anywhere that a bodily fluid can be transmitted from one person to another in a vacuumed environment. And that's the biggest part. Because if you think about sex, it's a vacuumed environment, right?
It is.
Which is why, though same-sex couples, lesbian couples, though their transmission rate is low, it's not non-existent, right? But they're different dynamics for each person's, way of putting the parts together. So you look at that, but we still want to educate because again, you're still dealing with STIs and things like that. Oh my goodness, what was the question you just asked?
Oh, I hadn't gotten to it.
Okay.
But, so my initial question was, are condoms, I know besides abstinence, are condoms 100% safe prevention of the passing of the virus HIV disease? Does that make sense?
Yes, and
Okay.
no, condoms are not 100%. Nothing is 100%, right?
Okay.
Because if Junior has had that condom in his wallet for a minute over the summer, I probably wouldn't want to use that particular condom, right?
Right.
But and that's what we use to educate young people about. Look at the expiration date. I mean, pick up the condom, look at it in the light. Do you see any holes in it? Do you see a hole in that condom? Because the things that have happened, right?
Yes.
These things happen. So if you use it correctly, and if you and your partner, don't use two at the same time. So many lessons that you have to know in order to boost its effectiveness. But if you're not sure of how to do that, then it's not going to be 100% of anything.
Right. What are some myths about HIV disease that you feel like we need to know?
Wow. I always say, having been inside this bubble for so long, I don't know what a lot of them are, right?
Really?
Because I don't. If someone doesn't tell me what it is, I am like, I don't know. So I hear new things. What have I heard? Anything lately? Myths. The cure part. I think that's one of the biggest ones. Is that there is no cure for HIV.
Okay.
We have seen in a couple, I think 2 people worldwide where there's been the cures, I hate to say that word, but they found that there's no HIV at all, right? Gone. But it had a lot of other variables to it. The man was suffering from cancer. It was another kind of research. He had a certain type of lock and key cell mechanism that made all of it work right.
Okay.
That ain't everybody. So there is no cure for HIV. I think another myth is, well, I can just get on the medication. No, you can't. No, you can't just get on anything. Not in America. I think people kind of forget where they live sometimes. Nothing is free here, right? And so HIV is an expensive disease. If you have insurance, you hope your insurance covers it, right?
Does it not?
Sometimes, yeah. No.
I thought this was mandatory.
No. If your insurance, will cover your medication, they may say we cover HIV drugs, but we only cover this one, this one, and this one. But if I go, but I want the injectable, the insurance company goes, well, baby, we don't cover that, right? So you have to know what your coverage will afford. If you are on something called ADAP, the AIDS Drug Assistance Program through the state, they have a formulary. These are your choices. This is what we cover. If you don't like it, you can go get it somewhere else, right? So it's not it's not always easily accessible to get the medication, depending on where you live or other variables that might impact your care mechanisms. So it's not a cheap disease. It's not the one you just want to roll with long term. There's definitely still discrimination out there, which is why you have a lot of people who don't come in to get tested because they fear what would happen around their orientation. They fear what would happen around their choices of behaviors and, the blame and shame game.
That was what I thought, that there was no discrimination with it anymore. Because,
no.
I mean, the climate and the culture that we're in now.
I mean, think about it. Every day, yesterday, somebody was negative, right? Yesterday, they were negative. They were doing their thing. Family life was good. Friends were everything was great. And today, they're positive. But what changes for that person? We have no idea. We have no idea what changed for that individual with this new diagnosis.
Yeah.
No clue what they have to walk back into and how they walk back into their own life with this new thing, right? I think that's what always gets me, is we forget that these are actual individual human experiences that have impacts in other places. What else is that person already dealing with? Do they already have a mental health? Was it a sexual assault that led them to this? What's going on that they have to walk back into their own world carrying this new bag, right? And how do we assist people with doing that? But then again, I take it and I go, well, for the person with diabetes, how do they walk back in? How do you walk back in when you're carrying just another bag? And
I feel like, and that's a valid question, but I feel like people look at those diseases completely different.
Absolutely.
So somebody walking back into their life or at work and say, I have diabetes, nobody's going to bat an eye with that. But you walk back into your life, you walk back into work, and I'm hearing it now as I'm saying it. I'm hearing it now as I say it. You walk back into work, you walk back into your life and say, I was just diagnosed with HIV disease. People are really going to...
Here we go.
Yeah.
Here we go.
I'm hearing
questions about your behavior.
Yes.
What did you do? And how did it happen?
Yes.
And, it's a and then every disclosure is a new disclosure.
It is.
Just like, your program. I'm so excited to do this. I love this. But it's going to air and everyone's going to see it because that's how fabulous you are. And, someone's going to go, I saw you on Crystal's show. That's their way of saying, so you have HIV. Okay,
Yes.
Either one, it's fine. But you don't want to be in a position where you're the opposite of that, which is I don't want anyone to know. I'll never say anything to anybody. And then I live a life of almost paranoia and isolation because now you can't engage and be fully you because you're always hiding and protecting something. And I have mad respect for people that have to do that, but I love being available to go, you don't have to, it's not always, you can be somewhere where you're okay and you're free to be who you are, however that manifests itself, But yeah, not everybody has that. And that's the crazy part, is that you think, well, surely, but no, not really. And in smaller communities, smaller towns,
it's even worse.
Reputations, family heritage, you got all that you're contending with. And so what do people do? They leave. They go other places where they're going to be able to find that safety.
And the acceptance.
Yeah.
Yes.
Well,
you have been in the HIV disease world for several years. At this point in your life, what is your intention?
It's funny you asked that because my colleagues / friends, because you do it long enough, you're just a family. We're all getting older, and like we know that we're the generation. I'm the age generation of medication. So all of my mentors in the HIV arena, in the fight, in the struggle, they've all passed on.
Okay.
You know, so we're standing there now, and young people will look at us and they go, "Oh my God, we're so glad you're here." Me, just me. I'm just me.
Yeah.
But we stand for something, right? We stand for keep going. We stand for and anyway. We stand for moving forward. So what I enjoy is watching and being a part of new initiatives and new ideas coming from people in the community that are like, I'm gonna do a movie on HIV and great, and seeing the communities own their space and tell their story and have take all the tools that have come along all this time and they remix them and they do really cool things with them. But I like to be a part of, yes, and remember, right? Let's not forget this was done this way before. So these tools that we used over the last 30 years, they may not be digital, right? They may not be social media ready, but they're still available for the community coming up now to tweak and redevelop and re-implement and reissue out as intervention strategies and tools. So it's fun being a part of those conversations and watching that manifest and be a part of. But at the same time, we're still building and growing in our own spaces. I want TAN to be a place where the positive community knows that they are welcome, knows that they have a home, knows that we're here and available. I want Southeast Texas to be more robust in addressing the issues that we have and being, I think, a little bit more honest too about what's really happening. We got meth, we got drugs, we got all that.
Yes.
We need to come together more as a collective. So I look forward to being a part of, whatever is being built. I like building things. So if we're constructing something, 9 times out of 10, count me in. I want to be a part of it. But it is nice to watch the community take it on and do things that in the social media space, in the marketing spaces, getting those messages out, using themselves as the brand or the poster for the movement, not just making a caricature or an ad, a campaign. It's me. It's really me. I am a real patient. To continue to show people that where you can go if you make that decision. So, but for now, I'm gonna stick at TAN. Love doing this. Love building this. But definitely, we'll always just continue to be a part. This is home for me. I don't really know how to do much else. The Lord gave me this.
Yes.
And He just gave me a bigger platform to dance on. So
Absolutely.
I'm just gonna keep on dancing, I guess.
Absolutely. So as we get ready to wrap up this podcast, and you have been absolutely amazing.
Oh, thank you.
Absolutely.
It's been so much fun.
Amazing.
Love
And you
these
know what?
conversations.
That's what I was going to say. This interview has been so much fun. And I'm going to be honest with you, going into it, I did not expect for this interview, this topic to be fun and exciting and laughter. I did not expect that. I knew it was going to be a good interview, but I felt like it was going to be like solemn, very calm type vibe. That's what I was thinking.
It's good stuff because we open, I think HIV opens a door to yourself that allows vulnerability. It allows humanity. It allows absolute, botching it 100%, right? It allows all of that, which just brings your whole humanity to the table, So I'm glad we were able to, laugh through it, and I don't take away the hardship that I know people in my community go through. There's absolutely not. I know not everybody has it easy, not everybody, but if they don't know anything else, they know that you can call me, and I've had the same number for over 10 years. You can call my cell phone, and if you need me, and you're going through, then Lord knows I'm gonna be right there, and that's a testimony anybody will tell you. So that's always the most important, is no matter who sees it, if you know somebody that is living with HIV, or you are, and you're looking for a connection, call me. You know, we know how to be there. We know how to be there.
What would be your singular message? And I know it's a difficult question.
Okay.
What would be your singular message for people living with the HIV disease and those who are not?
So the message to my community is, if you woke up this morning and you're breathing, keep going, right? Keep going. Then that's important, because I know how we wake up. I know that some days you wake up and you're like, not today, you know. So if you wake up, you're breathing, keep going. To the negative, or to people who are not living with HIV, and this is for everyone, right? This disease is not gone anywhere. It is still very much, very, very closer than you know. And if it's not you, then it could be someone you love, you know. HIV is just a mechanism that allows you to choose to be human and compassionate and kind. It's just a thing that tests you and what you offer.
Yeah.
So, you know, choose what you offer, you know what I mean? Because HIV, not to say that you're mean to somebody who's going to come around and get you, no, but, you know, what is that saying? Do unto others?
As you would have
That's
them.
a real thing. That's
Yeah.
a real thing. That's a real thing. Because one day you aren't, and one day you could be.
Yes.
You know?
And it's just like you said, you know, one day you're fine, you wake up the next day, and
You know, you take a test and there it is.
Yeah.
And now you're a we,
You're a
right?
Yes.
So, yeah.
Well, you are the first person that I've had on my podcast, and thankfully, thank God, I have my number is increasing.
Yay!
For guests on my podcast, where two people from two different worlds have said, you have to talk to Dena Hughes.
No.
I mean,
my
two
community.
people. John Manfredi,
Love
I
John.
spoke with him, he was amazing. Spoke with Barbara Wilson,
Yes.
she's amazing. Both of them were like, if you don't talk to anyone else, you have to talk
They
to
are so
Dena.
sweet. They are so sweet. I love them.
And they were
Thank
right.
y'all.
They
Love
were
them.
absolutely
Yeah.
right. I see why they were so forceful
Wow.
in saying, you need to talk to Dena.
I'm
They
glad.
were right.
I'm so glad.
Yes. they
I
were
thank them
absolutely
for,
right.
for even recognizing the importance. Again, you know, that's
Yes.
where it comes from, is the normalization in the community, where everybody moves and everybody brings their gifts to the table, no matter what it is. And someone is going to need that gift that you brought. You
Absolutely.
know, put it on the table, allow people to pick and go from
Yes.
there. So I thank my friends.
Yes, and I thank them too. Thank you.
Yes.
So, with that in mind, who do you think, and this is my favorite, my last
Yes.
question and my favorite, who do you think would make a great guest on the podcast, but you have to help me get them on?
I am going to say Ramona Young.
Okay.
Ramona Young is a Beaumonter. She is a school teacher,
Okay.
but she's also very big into genealogy. And so I think she would be a phenomenal guest to talk about her journey and her journey with Ancestry. That would be so cool.
Well, thank you so
And I will help
much.
you
Yes.
get her for sure.
Yes, yes. I cannot wait to speak with Miss
Yes.
Ramona. But thank you so much for sitting down on your beautiful red couch.
On the red couch.
Your beautiful
Is it a red
couch.
tabletop? Be the red
I know.
sofa. Red sofa.
my
There you
God,
go.
yes,
Yeah, the
yes.
red sofa.
Thank you so much for sitting down
Absolutely.
on the red sofa and having this, this
Great
conversation that
conversation.
I did not expect.
Yeah.
I did not expect. So
Thank you so much
for
for all of your really good questions too. I
Thank
mean, it's
you.
questions that people may have in their, they may want to ask somebody, they may want to know. You asked really, really great questions. So I hope I wasn't too, but you asked
Absolutely.
great questions. Thank you for getting the information out there.
Thank you so much.
Absolutely.
Thank you. And thank you so much for watching. You can get this podcast and all of my other podcasts on YouTube Podcasts and Apple Podcasts. And remember, you always have time to listen and learn on the go.
Crystal Petry Consult.